Residents of Mogale City are facing a catastrophe due to sewage pollution. According to science-based lobby group WaterCan, the pollution is likely going to cause a public health crisis. Sewage infrastructure collapse has resulted in thousands of litres of raw sewage flowing into rivers and residential areas. Joining us is Dr. Ferrial, who's the Executive Manager of WaterCan. Dr. Adam, thank you so much for joining us this evening. You just heard that report as well by Refilwe Seboko, our newsroom anchor, and speaking to residents there and how they've been affected by this. Take us through some of these problems.
So I think that, good evening and good evening to all your viewers. I think that we know that in our country, our wastewater treatment works are actually in quite a critical state, and almost 70% are not functioning well. So the problem is that there's not enough done to make sure that we actually reverse this situation. And what we're seeing in Mogale City is actually just criminal, because it's a case of a municipality spending money on the wrong things, whereas they could have fixed the wastewater treatment work.
You're saying they're spending their money on the wrong things. What are they spending the money on, if not to focus on this wastewater treatment plant?
So there's a few things. One is that we've been told that Mogale City has budgeted to actually build a new office building for the municipality. We know that I think they're spending about 150 million this year, so I don't know what's the total cost of this project, but they could have spent that money fixing the Percy Stewart wastewater treatment works for about 80 million. And so, they have not done that. They spent on Percy Stewart, they spent about 8 million in the 2021-2022 budget year, and that has been reduced by 120%.
So when we're looking at the Rooigrond wastewater treatment plant that's taken forever and there's been delay after a delay, would you say, Dr. Adam, that there's clearly no will at all to get this going if we're spending our money on office space?
Absolutely. I think we're prioritizing the wrong things. We're prioritizing the vanity projects. And I think that kind of, it shows a complete lack of connection that our politicians have to what is happening on the ground, where you hear people on your show talking about the struggles that they have to go through because they don't get basic sanitation. You know, we talk about, and the Department of Water and Sanitation's slogan is, water is life, sanitation is dignity. So when we have municipalities behaving this way, where they're spending money on a building, or they're not putting the will and the political will and energy to make sure that the wastewater treatment works are functioning, as in the case of the Northwest, then it's a complete disregard of people's basic human rights and their dignity.
Yeah, the disregard of basic human rights, as we're listening to residents there speaking about how they live under such conditions, but also just being left in the dark as well by their municipalities and not communicating with them. But as WaterCan, Dr. Adam, you also warn that there could be health implications that we are subjected to because of this.
Absolutely. I mean, I think that, you know, with sewage flowing, and basically it's raw sewage. So it's not even being treated. It's not even being half treated. What you're finding is that the water's not treated. So you've got industrial waste, chemical waste, sewage that are flowing into our rivers and streams, right? Now, E. coli is an indicator bacteria of other pathogens that could be in that water. You could be dealing with hepatitis, you know, a whole range of other things, cholera, all of those kind of diseases that go with that kind of dirty water. The challenge is, Masa, is that in our country, there's 9 to 10% of our country's population rely on these rivers that are so heavily polluted with sewage as their basic water supply. That is where they get their water to drink, to cook, to live on. And so can you see the kind of, there's a potential here for a real devastation in terms of health issues And we hear it all the time. We hear of, areas where people would say that there's been an increase in diarrhea. There's been an increase in people getting sick. You can't create those linkages unless clinics are looking for that. But I can tell you that with E. coli, with sewage, there are other pathogens that are in the water as well.
And listening to that report as well by Refilwe Seboko, speaking to some of the authorities there, we heard that the Department of Environmental Affairs was supposed to be consulted, but wasn't. I mean, when you are taking part in such a project, isn't this a no-brainer that, of course, you must consult with the Department of Environmental Affairs?
Absolutely. The fact that it had gone to the point that it has without consultation for me is very strange. It's like basic 101. You want to construct something, there has to be environmental impact assessments, there has to be permissions that you get because you need water, you need a license for effluent. So there's the Department of Water and Sanitation as well as the Department of Environmental Affairs. So this sounds very strange.
Now, this raw sewage, as you mentioned as well, the sewage is also not only seeping in through like residential areas, through our rivers as well, but through historical sites like the Cradle of Humankind, for instance. Talk us through that.
So that's the other concerning thing is that, that's a World Heritage Site. And South Africa thrives on telling people about our tourism and our sites and our heritage sites. So that is so significant for our history and the starting of everything in terms of the cradle of humankind. But the sewage is polluting the area, it's damaging the area. So you're not, you could result in, firstly, I'm not saying this will happen, but you could get that the UN decides that this is no longer fitting of a heritage site and removes that title, which we don't want happen in that area, but could happen. You're reducing your tourism. In fact, Masa, there's a joke at the moment because the reason this whole issue has now come back onto the media, because it's been there for a while, is because one of the activists or one of the people that's been monitoring the water in that area has started running, I'm sorry to say this on live TV, but he started running shit tours. So, because that's how bad it is. And his plan is to try and get as well the Portfolio Committee on Water to get the minister to actually go on one of those tours and to see how bad it is and that it's affecting tourism and could damage the heritage site in the area.
Sure, shocking, Dr. Adam. Now, as WaterCan, how do you suggest that this problem be solved? You're also calling for more punitive measures, but you're also calling on Treasury to ring-fence water and sanitation tariffs.
Yes. So the thing is, what we're concerned about is that the municipalities will go off, spend money on building a building, an office block, not fixing the wastewater treatment works. Then when we go there and say, can we fix this? They'll say, oh, we have no money. But then they'll apply for the municipal infrastructure grant. And that comes from national government. We're saying that if national government gives a municipality, or specifically Mogale City or City of Joburg, a municipal infrastructure grant, they need to ensure that it's ring-fenced so that the money is spent on water and sanitation infrastructure. Otherwise, that money just gets lost in somewhere.
Yeah.
And we think there needs to be better controls. The other thing we need to be mindful of is that municipalities are not paying their water bills to the water boards. And we can't afford to have the water boards collapse. So we're also saying that maybe national government needs to pay the bills directly to the water boards and skip out the municipality.
Cut out the middleman. Oh, Dr. Adam, thank you so much. It's always a pleasure hearing from you.